Hi, everyone. For those on the line, we're just going to wait a few more minutes until 3, and then we'll get started. Hi, all. For those that just joined, we're going to wait 1 more minute or so to let some attendees come on and log on, and then we'll get started. Thanks. Welcome, everyone, and thank you so much for joining us today. My name is Jessie Canham, and it's nice to virtually meet you all. As part of the Educate for Opportunity NGA team, I'm really excited to have you all on the line for this conversation about basic needs. Firstly, I hope you all are well and safe. Thank you for the work that you're doing every day to support students in your communities during this very uncertain time. Discussing the importance of addressing college students' basic needs is even more pressing and relevant now due to the COVID-19 pandemic. Reengaging adult students in education and training pathways is a primary focus of the cohort, and a key component of this work involves addressing the non-academic needs of today's prospective and current students. This includes how access to food, housing, transportation, childcare, and other resources affect students' willingness to enroll and ability to persist in college. We've got an awesome lineup of presenters today to discuss this issue. Our first presenter is Dr. Sarah Goldrick-Robb, founding director of the Hope Center for College, Community, and Justice, and professor at Temple University. Dr. Goldrick-Robb is a leading expert and researcher in the field of food and housing insecurity in higher education. Our next presentation will be highlighting the resources and technology of SingleStop. Joy Bass-Smith, Director of Business Development and External Affairs, will describe how SingleStop supports colleges across 10 states in connecting students to public benefits and community resources. And finally, we have Rebecca Butts, Director of Outreach Programs at Family Promise of Morris County in New Jersey. Family Promise is a community-based organization that has worked closely with SingleStop to help connect people in Morris County with housing, food, and other resources, including recently launching work at a local community college. Huge thank you to our presenters for convening with us today. A few notes about the webinar platform before we get started. This webinar is being recorded and will be sent out to you all following the webinar. All lines have been muted to minimize background noise during the presentations. As your thoughts, comments, and questions arise during the presentations, please add them to the Q&A box at the bottom of your screen. The NGA team will be monitoring the questions that come in and will address them together during the Q&A portion of the webinar. Additionally, the chat box is available if you need to contact any of us about tech difficulties. Now on to the content of today's discussion. We'll start with an overview of the national landscape of basic needs for college students and state policy levers that can be utilized to support students. Next, we'll move on to a conversation about coordination of support services for students. Then we'll have about 15 to 20 minutes of time for Q&A, and then we'll close out by sharing some resources and upcoming cohort events. And without further ado, I'll hand it off to Sarah.
Hi, everyone. I'm really glad to be here with you today, and I thank NGA for the invitation. I'm pleased to share with you some work that my team has been doing, both around research and around technical assistance to both states and colleges and universities around the country that we hope will prove useful for you. For the next slide, please. Before I begin, I'd like to first tell you, and I apologize that, of course, as I just started talking, the house got noisy. My apologies. I want to first tell you about the Hope Center briefly. The Hope Center for College Community and Justice, for those that are not familiar with it, is an action research center based at Temple University in Philadelphia. And our team is a combination of folks who have PhDs and work on research alongside practitioners, many of whom have worked in higher education. We actually have a director of community impact who was formerly the head of SingleStop, for example, at the Community College of Philadelphia. And we also have a policy team, many of whom have also got a great deal of experience working both with states and the federal government. The director of policy actually starts in just a few weeks. Her name is Carrie Welton, and some of you may know her from the Center for Law and Social Policy. And then we also have a talented team of communications experts who really help us, especially working with cities, to try to change the language around who today's college students are so that their basic needs can in fact be met. And all of that work together for the last decade or so has really centered on students' basic needs. We take it as a centerpiece of our work. We take it that students are humans first. And therefore, when we think about these basic needs, frankly, we do view them as central academic concerns. Because whether you have sufficient food or housing is a condition of learning. And many of you have probably thought about that for sure in the K-12 context. We know that teachers find it very hard to get students to focus on material if they haven't had anything to eat. And here in the higher education context, the same thing is true. Next slide, please. So I want to give you a few insights from what we call the Real College Survey. Now, I want to be honest about the name of this survey and where it came from. Some of you may be fans of MTV and, like me, watched The Real World for quite a number of years. When I was really getting to know the higher education landscape, and particularly listening to how people talked about today's colleges and their students, I really thought it's time to stop being polite and start getting real. And so we coined the term #RealCollege to talk about the genuine challenges that are really constructing students' lives. We don't find that too many of them are honestly thinking about weekend parties, but rather thinking about how to juggle their work schedule, sometimes their parenting, alongside their academics, and of course, all of the other work they do to pay their bills. We began fielding this survey in 2015, and this past February, we released our 5th annual report. In the first year that we did this survey, only 10 colleges in 7 states were willing to participate and allow us to ask their students questions about things like food and housing insecurity. But over time, that number grew, participation expanded, and we now have data from over 330,000 students at more than 400 colleges and universities. In the next slide, you can see that these are in fact distributed all over the country. So depending on the year that you're looking at, we've had really widespread participation. In some states, in fact, we've surveyed all of the community colleges in the state. Most recently, we did that in Oregon. We've also done that in Washington State. And we surveyed half of all the community colleges in the enormous state of California. We've also done this survey for the entire CUNY system, the entire system in Dallas, Texas, in Maricopa, and you can find all of those reports publicly available on our website, and I'll be providing that information later as well. Next slide, please. These, as so you can see on the screen, are the bottom line numbers summarized across the 5 years of data that we have. We're not able to speak to trends over time because before we started doing this survey, data were not collected in a regular and systematic way around the country. The federal government has never seen fit in its nationally representative surveys of students to ask these questions. And to our knowledge, states have not conducted any relevant surveys in this regard either. There are surveys of households, but college students don't fit particularly well into households. One reason being that they often live apart from their parents for a period of time. And the secondary reason being that many of them are housing insecure, so they're often missed by those household surveys. What you can see here is that a substantial number of students are affected by basic needs insecurity. It's as many as 1/3 of students at four-year institutions and as many as 1/2 of students at community colleges. Now, if you're looking for all the definitions of the terms on your screen, you can find them in our reports, but I will make sure that you know that these are validated measures. For example, the food insecurity measure comes from the United States Department of Agriculture's measure of food insecurity. The measure of homelessness that we use is aligned with the McKinney-Vento Act in recognition that these students are first and foremost students. Just like high school students who are homeless, they transition into higher education and often need the same kinds of support. Next slide, please. Now, we do also consider, independent of just those single measures of food and housing insecurity, we do ask the question, how many students can we say in our surveys were actually completely fine with regard to their basic needs in the last year? Because of course, things like food and housing insecurity can intersect. And it might be that one student experiences something like food insecurity in one month and experiences homelessness in a different month. And when we look at the data that way, we see something a bit more staggering, which is that of all the community college students that we've surveyed, only 38% of them were fully and completely secure when it comes to their basic needs. And the same is true for only 49% of students at the four-year institutions. What this suggests is that these challenges are truly widespread and that we cannot think of them as only occurring for a small number of students who could be accurately identified through targeted programs. These numbers suggest the need for something more approaching universal design in the delivery of support. Next slide. Now, of course, there are disparities. As she clicks through the slide, you'll see that the same racial disparities that we see in K-12 education and around the country are mirrored when it comes to college students' experiences with food insecurity. You can see we have a number of different populations we report on in our surveys. There are 11 different racial ethnic categories that we give students as options, and they can also choose to self-describe. We have a very large population of Indigenous students in our surveys because we have obtained participation from 7 tribal colleges. And you can see here that there are widespread disparities. Even so, even for the white students who many think don't have these problems, more than 1 in 3 were affected by food insecurity in the prior 30 days for when they took the surveys. Next slide. The same thing is true with regard to homelessness. Here I'm highlighting students in a number of targeted categories. Students who have children, students who've served in the military, students who have returned from being incarcerated in prison to attend college, and students who have exited foster care. All of these groups are at particularly high risk of experiencing homelessness while in college. All of them are therefore less likely to graduate. Next slide. Let's take a look at one other key disparity that we see here. This is based on how students identify their sexual orientation and their gender identity. We often find that LGBTQ students are at greater risk of basic needs insecurity, and here you can see this is the case with regard to homelessness. The reason, well, it's complicated, but one of the main causes has to do with the financial aid system. We find that the financial aid system often concludes that a student doesn't need financial aid because their parents have resources. So the student, for example, is not Pell eligible. And if the college is limiting assistance based on that, or the state is limiting assistance based on that, these students will not receive it. However, this is a group that is more likely to be estranged from their families. And as a result, they're not receiving their parents' support. It is not easy for students to go to a financial aid office and convince them to render them independent for financial aid purposes. It's not because financial aid officers are unwilling. It is because the law greatly limits their ability to do that. Next slide. Here we take a look at the percentage of students who are facing any basic needs insecurity, getting access to resources. So in the first line, you can see the percentage using any form of government assistance, and we cast a very wide net. So this could be getting SNAP, this could be using TANF, this could be WIC, this could be EITC. And you can see here that just over 1 in 2 community college students get access to some kind of assistance. That's a number that we have in fact seen go up a bit over time, but it's lagging at the four-year institutions. We also see that despite the fact that a lot of college campuses say they have support available, and in fact, a recent survey of college trustees found that 70% of them said that when it comes to addressing basic needs insecurities, their college has this handled. Only 14% of community college students who are facing basic needs insecurity, and only 21% of those at four-year institutions, say they're getting any campus support. And it's particularly challenging when we get to issues like emergency aid. I'm sure many of you have been following the debate over the CARES Act and the emergency dollars that go to students. There are several issues there that we should discuss, but one of them is that while colleges often do have emergency aid, they are not effective when it comes to distributing it. And we can see here the consequences. Just 2% of students facing basic needs insecurity saying they've received any form of emergency aid from their institution. And then down below, you can see the percentage of students connecting to SNAP who are dealing with food insecurity. The USGAO issued a very important report in December 2018 highlighting this issue, and the percentage of students who are using a campus food pantry. There are over 800 campus food pantries around the country, yet just 1 in 10 food insecure students say that they're using it. This is one key reason why we at the Hope Center think that college food pantry employees are important, and that food pantries represent efforts to address food insecurity, while at the same time we acknowledge we have to go way beyond the food pantry in addressing these concerns. Next slide. So these issues are very clearly both an enrollment and a completion challenge. They're an enrollment challenge because some students can't come to college unless they know that these needs will be addressed. Some of them have stopped out of college and will not re-enroll until these concerns are addressed. And they're a completion challenge because there is no question that students dealing with basic needs insecurities have lower grades, lower rates of retention, and lower graduation rates. And these are not mere correlations. There's a growing body of evidence that establishes that these are causal. In addition, there's a direct financial challenge to the institution. Financial aid dollars pulled down into institutions benefit those institutions, they benefit the communities, and they benefit states. But when students can't make the grades to keep their financial aid, those dollars are lost. In addition, when institutions don't know how many students are affected by these challenges, they miss out on opportunities not only for philanthropic dollars, but increasingly they're going to be missing out on opportunities to draw down federal dollars. There are more than 7 pieces of pending federal legislation that would address students' basic needs, but first require colleges and universities to report how many of their students face these concerns. For these and many other reasons, we think that anyone with fiduciary responsibility ought to be concerned about whether students' basic needs are addressed while they're in college. Next slide. Now, a few updates from your states, and I want to first point out that it's totally possible that there's work going on in your states that my team is not aware of, and if so, we'd love to hear about it. But in addition, I want to acknowledge the current context. Obviously, COVID has done tremendous damage all over the country. The one little tiny silver lining that we are seeing is that students' basic needs are, in fact, being prioritized more than before. We're seeing that here in Pennsylvania, and you may be seeing it where you are as well. We do know that in Louisiana, the Governor's Commission on Post-Secondary Education and the Workforce is paying some attention to basic needs and security, and we were delighted to have a member of that commission at our recent conference where they were learning about ways to address these challenges. Massachusetts has been especially active, and I want to give a shout out to Commissioner Carlos Santiago and his team, where they have engaged in systematic data collection, they have expanded access to SNAP, and they're currently piloting a really interesting housing program that's a joint effort between community colleges and public universities. In Minnesota, they passed a hunger-free campus bill that helped institutions expand their capacity to address food insecurity, and they created a pilot program for emergency aid. Next slide. In Ohio, they've worked to expand SNAP access. One of the big challenges in Ohio that remains to be addressed has to do with institutions' ability to distribute emergency aid, and we're hopeful that there will be some changes there. In Pennsylvania, as I said, there's been some expansion of SNAP access, which is terrific, and Representative Malcolm Kenyatta is advancing a hunger-free campus bill. We don't know, quite frankly, what's happening in Wyoming, and we're eager to learn. Next slide. Now, there are a couple of other states I want to point to. California is always the one in the basic needs movement that people point out, so I'm not going to do that here. Instead, I'm going to suggest that you take a look at what Washington State has been up to. Last year, legislators advanced successfully comprehensive supports for students' basic needs, including a new emergency aid program, some pilot programs for homeless college students that are operating, I believe, on about a half dozen campuses, and increased resources for the community colleges and technical colleges themselves. That's a really good combination because, as you can see, part of the issue is what's available to students, and part of the issue is utilization of those existing programs. That really changes when staff are able to be hired to do the outreach and connect directly with students. In New Jersey, they've also engaged in some nice statewide data collection. They had a hunger-free campus bill that was passed in the last couple of years, and they've also engaged in expanding SNAP access. And the SHIO in that state, Zakiya Smith, has been doing some very good work to try to continue pushing on students' basic needs, I apologize. Next slide. So a couple of things for governors to be thinking about. First, when we talk about COVID relief, I really hope that college students will be more centered in the relief efforts. Unfortunately, the stimulus dollars that came down cut out a lot of college students under the seemingly false impression that if their parents claim them on their taxes, they must also be providing them with support for their living expenses. That's a stereotype for which there is not a lot of available data, and we think that it is false, and unfortunately, these students are not getting much help. In addition, even the CARES dollars for emergency aid, which did look like wonderful relief, unfortunately, yesterday, the Department of Education issued new rules that cut about 1.5 million college students out of even that support. And this, unfortunately, is yet another form of administrative burden that effectively makes policy. These policies become very inaccessible for students and create equity concerns. A great example there is the SNAP program. For college students who are enrolled full-time, well, first, many think because of the way the authorizing legislation is written that they're not eligible for SNAP. They are eligible, but they have to meet a set of conditions. One of those conditions can be working. Unfortunately, due to widespread layoffs and unemployment, many college students are struggling to work. There is a disaster SNAP bill that is being considered, but it's not moving fast enough. And in the meantime, there are a number of people who need access to these supports and cannot get them. Next slide, please. The CARES Act implementation of emergency aid is critical. The move yesterday by the Department of Education created a number of problems, and one of the problems is that it set back students and colleges in states that were already making preparations to get the money out the door. So for the last 13 days, your colleges and universities have been planning for the distribution of the dollars. The rule change means that all of that work has to now be revisited, and they have to set up new guidelines and new ways of trying to get the support to students that first verify that they are Title IV eligible. This is something for which they're going to need substantial support. The other thing that's so important is that supports are put into place that last. In this particular case, of course, the pandemic is not a hurricane, and we don't know when it's going to end. The need is ongoing. But also, there's very little reason to think that investments in basic needs and security supports would need to only be there for a couple of years. These are investments that are going to need to be in place, especially as we continue to expand access to higher education for people who don't come from wealthy families. Next slide. Now, our website has a lot of support for you. The most prominent and important time-sensitive thing I want to alert you to is that we are now signing up institutions around the country and systems for the fall 2020 Real College Survey. You can find that information on our website. Everyone must sign up by the end of July. We also offer a range of technical assistance that is provided by our practitioners and our policy team. And we have an enormous number of COVID-related resources that you can find on our page there. So please do check us out and get on our newsletter so that you can get those resources delivered. I believe that's my last slide, and I thank you all so much for having me.
Thank you so much, Sarah. That's definitely a lot of great information to think about. I want to remind everyone to please enter your questions into the Q&A box. And next, I will pass it on to Joy and Rebecca. Take it away.
Hello, my name is Joy Smith. I am from SingleStop, as she mentioned. You can go to the next slide. And I'm going to be here today to talk a little bit about what we do and how we help colleges help students access benefits. And so we've been around since 2007. We're a national nonprofit that builds capacities with our partners, be they community colleges, four-year colleges, or community-based organizations. And over the years, we've helped connect 2 million households to over $6 billion in benefits and resources. Next slide, please. I know the cohort here is select states, and just so you can see the overlap, I wanted to put together this map for you. And so we have 2 regional offices, one in New York City and the other in Raleigh, North Carolina, but our partners are in these 10 states and as well as DC. And so our program model is listed here. What we do is we provide technology, programmatic support, and data and analytics for our partners. And so our technology is a benefit screener where in as little as 15 minutes, a student can find out the federal benefits that they're eligible for, like SNAP, WIC, and EITC, as well as resources that are available in their community, like food pantries and legal services and financial counseling services. So we have the technology. We teach colleges how to use that technology, as well as the data collected in the technology to help their students complete college. And our partners, in turn, provide staffing to assess the eligibility and need of students, to facilitate access, to advocate and support, and to connect them to community resources. So what we do is we like to provide a holistic experience for students. The goal is ultimately to have students complete college and put them on the path to self-sufficiency, leading to better opportunities in education, employment, and general well-being. The way we do that, again, is to connect them to existing safety net resources through those benefits, but also identifying wraparound services that could help sustain them, connecting them directly with those service organizations, and then destigmatizing the help. And this is something that's been very important for our work on college campuses. We like to make sure that students who seek help understand that there's nothing wrong with seeking help. So we work with colleges who may put a link to their SingleStop technology on their syllabus, right? Or we work with colleges where the student government really makes it a point to talk to their peers about how important it is to go seek food pantries on campus, to seek help with your taxes. All of this is really in support of getting the students to stay in school and graduate. Next slide. So is it working? We've had 2 independent studies done, and these third-party studies were done by the RAND Corporation as well as Metis Associates. And they have found when comparing SingleStop students with a matched peer group that SingleStop students are more likely to persist, to complete more credit hours, to have higher GPAs, and they graduate at rates more than double that of their peers. So we know that this works. It's a high case management type model, but it pays off because students make it to graduation. Next step, next slide. And since we started our work with colleges in 2009, we've helped connect over 200,000 students to over $400 million in drawdown. 92,000 of those services include tax returns, which taxes are a great way to put cash in pockets of students. And pretty much all working folks are eligible to get their taxes done. This is our free tax preparation services. 19,000 have been connected to legal services or financial counseling services. And these are things like students who've been victims of identity theft, or maybe they need help financial counseling figuring out student loans and how to balance that with their bills and their children. So we are really proud of this impact that we've had, and we obviously from the studies that we've had, we show that this is working. Next slide, please. So one thing that we've done differently is we piloted a new model in New Jersey, the same foundation, the foundation of providing these wraparound services in their communities and giving them access to benefits. Only this time, instead of working specifically with community colleges, we've worked with a lead organization in each county, and they coordinate the network. And so we partner with the CBO. They have resources that we can't necessarily offer. They have partnerships with organizations within their own county, and they often work with community colleges in their county as well. And we've used this model in New Jersey to develop best practices that we are now utilizing across the country as we talk to folks about how to better support not just low-income students, but their families as well. And so Rebecca is here from one of our networks in New Jersey to kind of talk about her experience working with SingleStop and the way that they built their model out in New Jersey. Rebecca.
Hello, thank you, Joy. And thank you everyone on this call for being part of this really important conversation. I'll start by providing some context on my organization's partnership with SingleStop. Family Promise is a national nonprofit organization dedicated to ending the crisis of homelessness. Our mission is to help low-income families and families experiencing homelessness achieve sustainable independence through a community-based response. We have over 200 affiliates nationwide, including affiliates in each state represented on this call. Our Morris County, New Jersey affiliate serves families and individuals across the county who are either at risk, currently homeless, or recovering from homelessness. We offer a continuum of services, including outreach, emergency shelter, and supportive housing. We were invited to partner with SingleStop in 2018, and right away, it was a natural fit. Both of our organizations value a holistic model of care that addresses each person's hierarchy of needs, helping them toward long-term self-sufficiency. SingleStop instantly benefited us by providing a comprehensive online tool to screen and apply for benefits. The tool takes away the guesswork of applying for benefits, allowing us to work more efficiently and encouraging clients to stay engaged. The technology also helps us to ensure that nothing is missed. The SingleStop term used by SingleStop is bundling of benefits and services, which means that the person is receiving all of the assistance they might be eligible for at one time, providing an actual step up out of poverty. This is consistent with one of our most important best practices at Family Promise, which is providing all of the necessary services in one place. Otherwise, our interventions are fragmented and therefore ineffective in the long term. We specifically designed our drop-in center and mobile outreach van to provide one-stop shopping for all of the services a person could need based on this approach. And I'll speak more on these programs in just a moment. On the next slide, you can see an illustration of our current network. We built this network based on our agency's existing philosophy and best practice of collaboration with our community partners. We take great care to create positive working relationships with direct care staff and leadership alike. Family Promise has provided shelter and case management services in Morris County for 30 years. So we have an established reputation that enabled us to build out our SingleStop network across the county with relative ease. And I say relative ease because of course it took a lot of work, but our existing partnerships paved the way for SingleStop to readily be accepted as a new way to serve the community. And very importantly, obtain permanent solutions for people who are struggling. Our staff make monthly site visits to other nonprofit partners, such as our community soup kitchen, food pantry, the Salvation Army, our Family Justice Center, etc. We attend community events and visit local libraries to meet other community members who may not already be accessing these other resources. Last fall, we officially signed on the County College of Morris as one of our newest partners, and we're so excited to be moving forward with this partnership. As Dr. Goldrick-Robb clearly explained, there's such prominence of food and housing insecurity in college campuses that directly affects students' success. SingleStop helps to fill this gap by using a bottom-up approach of meeting students' needs, enabling them to stay in school, earn a degree, and obtain gainful employment. Students' greatest needs are typically food, housing, childcare, transportation, not even academically based. This March, after a lot of planning, we had our first in-person visit to the County College of Morris. And unfortunately, this coincided with the need for the school to shut down and switch to remote learning in response to COVID-19. Still, this visit was highly informative and solidified our understanding that the student population is hesitant to reach out for help due to stigma, but we continue to collaborate with college staff to facilitate referrals to SingleStop through trusted staff that the students already know. And fortunately, SingleStop is perfectly set up to serve people remotely, so that really hasn't been a barrier. We just haven't continued our in-person visits. We're also adjusting the language that we use to better suit this population. For example, if you're unfamiliar with the system, the term Medicaid may be a turnoff, but healthcare or health insurance is something that everybody needs. Moving over to local government, our relationship with local government and our Department of Human Services and Social Services office is absolutely key to our success. We have a very unique agreement to share information between our caseworkers and our local welfare office via a release of information. And this enables our staff to communicate directly with county staff. It streamlines the process of applying for benefits. I wish that this was common practice in all communities, because without it, we have an overloaded system, staff with impossible workloads, a backlog of rejected applications, and far too many community members who aren't accessing the help that's available to them. This working relationship has led to further innovation in our county. On the next slide, you'll see our mobile outreach van, Navigating Hope. Navigating Hope is a collaboration between Family Promise and our Department of Human Services. Our county sheriff was actually the first to implement a mobile outreach van in our community. It was fully funded by forfeiture money and designated to provide access to substance addiction, recovery, and support. It quickly became apparent that visitors to the sheriff's van needed help with other things. Food and housing insecurity, sound familiar? case management, mental health counseling, transportation in more rural areas of the county. So our board of chosen freeholders decided to fund the Navigating Hope van, which carries county welfare office staff and a family promise case manager. We work in tandem using SingleStop as a tool to connect community members to all of the benefits and services they may need. The van specifically travels to all 39 municipalities in the county, targeting more rural areas and populations such as seniors who may not be aware of services or how to access them. The holistic approach on the van directly connects to our bottom-up approach of meeting basic needs, delivering services in a stigma-free way and enabling people to access higher education by helping them to achieve stability via access to financial assistance, housing, healthcare, food security, childcare, etc. So overall, SingleStop has allowed us to really evolve our traditional format of case management and expanded it into the realm of resource navigation, which allows us to to broaden our reach and help more people toward upward mobility. This is done through meeting basic needs, connecting people to higher education, and making it possible to successfully complete a degree. This is all accomplished by connecting people to a network of existing resources and using individual providers' expertise to get the job done. On the next slide, Joy will just give you a couple quick SingleStop COVID-19 resources. Thank you.
Great. Next slide, please. So when COVID-19 first happened and all our states started quarantining, SingleStop was in a unique position in that we were very accustomed to working virtually because we have partners all over the country. And so we quickly realized that there was an opportunity here for us to help others in ways, and maybe some organizations or states weren't as prepared as we were to do this work. And so the first thing we did was make our screener public. Traditionally, only our partners have had access to this technology, and it's because we like to have a very close relationship with our partners. But the technology is a very data-driven technology, meaning that like after you screen someone, all of that is recorded, and any of our partner sites are able to track their performance, how they help students, and identify trends over time. However, due to the circumstances, we felt like it was very important to have everyone to have access to the ability to screen either their clients or themselves. And so our screener is available on all mobile apps with just a click of this link that you see on your screen. You can do it on your phone, on a tablet, on a laptop, and in 15 minutes, as I mentioned, you could find out what benefits that you're eligible for and what resources other than state and federal benefits are available in your community. And so we've been sharing that out. This is, just to be clear, it's only for the states that we operate in. So those 10 states that you saw at the beginning of the slide deck, those are the states where this screener is applicable. When someone screens themselves, they are also contacted by a SingleStop caseworker to find out if they need extra help or advice on how to pursue the benefits that they're eligible for. The next thing we did is we went state by state and we just combined them into a resource sheet. So our fact sheets basically are just each state's best and available resources and emergency resources. And so this was just a way that we could collaborate with organizations that are already doing work. We get their links, we put them on our PDFs, and we're able to share this out with people very quickly. And so if someone was looking for food resources, they could look at this list and get the top few in their communities. Same for policy changes, right? Because things have been changing so quickly with COVID-19 that we wanted to have a resource for people to figure out what was happening. And so like when we were waiting for the CARES Act, when that happened, we were able to update our fact sheets very quickly for folks. And we continue to monitor all of the changes that are going on at the federal and state levels so that we can add them into here. So just as an example, there's been a lot of confusion about unemployment benefits, and each state, slightly different processes. And so we're able to add that type of information into these fact sheets. These are very timely sheets that are being updated on a regular basis. And these are great to share with the folks in your network if you need someone, need some quick resource and a handy guide. And then lastly, we started doing public webinars. For instance, we have one that's very popular on virtual case management. And so our staff are just really telling folks what we've learned over the years. We've been doing this for many years, and we have a lot of experience serving clients virtually. And so we've been able to just do free and public webinars for our networks on that, how to use our public screener. We've been teaching people about benefits eligibility. And one thing that didn't make it onto this list is that we also have a link on our website if people want to file their taxes on their own for free. We have a version of TurboTax that is free for low-income families. And it's a really easy to understand way to do your taxes yourself. So SingleStop has tried to have a multi-dimensional approach to this COVID-19 response. In addition to all this, we're still doing our regular programming. We're still consulting with colleges and organizations across the country. We're still providing direct services in some areas. So we have a lot going on, but we are definitely here. I think the years of research and just hands-on training have really set us up to be a great resource for you. So if you're in your state and you're looking at this and you're thinking, oh, who do I send folks to for help? Definitely use the links that are on the screen. Thank you. And this is just contact information. So Rebecca and I are both available if you need to get in touch with us. My email's there and hers as well.
Great, thank you so much, Joy and Rebecca. Definitely a lot to think about, and appreciate you talking about the strong collaboration between your two organizations, as well as sharing all the great SingleStop resources that are now available publicly to states. And so now we're going to start with our Q&A portion. I can see that some of you have already added your questions, but I'll pass it on to Michael Benino-Brish of NGA to facilitate any questions that have come in so far.
Thanks, Jesse. A lot of great questions, and so we're just going to jump right into it. The first question is for Sarah. From your research, what would be your top priority recommendation for governors as they plan for their state-level emergency relief funds?
Yeah, I mean, I think that the most important thing that you can do is to take advantage and maximize the federal flexibilities that you have to lessen or lift restrictions on post-secondary activities for anyone in a public benefits program. I think that's the most important thing that you can do. You might also want to just maximize in general with regard to SNAP, maximize the broad-based categorical eligibilities in SNAP if you haven't already done that. So I think those are really important considerations. And then once you take a look at the CARES Act emergency aid dollars for higher education and who those end up going to, you might think about filling in, if you can, if you have some non-federal dollars, to think about filling in where those leave some populations out.
Great, and as a follow-up to that, one of our attendees wants to know if you can explain further what you mean about Ohio having issues with distributing emergency aid. Is this a pre-COVID or current issue?
It's a current issue. It has to do, it's a little bit of, I'm gonna get a little wonky with you for a minute here. So it's a little inside baseball financial aid challenge. One of the big questions, and it is addressed in the CARES Act actually, is whether if a student receives emergency aid dollars, if those dollars need to be reported to the financial aid office and contribute and may count against students' financial aid eligibility going forward. And the CARES Act dollars, it's interesting. In the last day or so, we did get some information that the CARES Act dollars for the emergency aid could be treated rather as hardship dollars. And so, for example, for tax purposes, it's not as though that will be treated as additional income. But in Ohio, the colleges really report that they struggle because the institutions are told that they must count every one of these dollars that is distributed to a student, even for their basic needs like food from a food pantry, that they must quantify the value of all of those dollars and then report them to the financial aid office and give them out to students. And while that might seem like it's about maximizing equity and ensuring the best distribution of dollars, what it really does is add administrative burden. It adds time between the time when the aid office can make a determination for students and when they're able to get their funds. It adds paperwork and bureaucracy at the institution side, and it can create some confusion among the financial aid office and other offices on campus. So this is something that every time I'm in the room, especially with community college leaders from all over the country, the folks from Ohio will very consistently bring up as a major barrier to doing effective emergency aid distribution.
Great, thank you. I'm gonna bring in Joy for just a quick second. One of our attendees is looking for a little bit more information on SingleStop. Are there like physical locations in certain cities, or is this more of a national program? And as a follow-up, is there a SingleStop in Ohio?
So there is not yet a SingleStop in Ohio. So the way SingleStop works is the physical offices are actually staffed by the people at our partner organizations. And so SingleStop provides the technology, the program support for those organizations to enhance their own mission-driven work, right? And so part of our technology includes a tool that allows people who need help to search for community resources by zip code. So when we partner with a new organization, we really work with that organization to understand who are their preferred partners that they refer folks to, and also what other partners we can bring into their own networks. So there's not a single staff member, like I wouldn't be at an organization. We teach those organizations how to do the work that we know how to do. Does that make sense?
Oh yeah, yes, totally. And here's a question I think both of you can like answer is, can you share any advice specific to meeting the needs of undocumented students who aren't eligible for federal benefits and aid?
Well, it's a tough situation, especially since until yesterday, it seemed that in fact they would be eligible for the CARES Act dollars because the authorizing legislation said that this was not Title IV aid. And so one of the reasons that yesterday was so difficult was that the planning time for the distribution of that aid has not included alternative plans for those students. And I know that there are some state attorney generals, for example, that are looking at yesterday's decision and trying to figure out if that could in fact be challenged. I want to fully recognize this is a controversial topic, but there's good empirical research that investing in these students really does pay off, and lowering the price of college for them really does increase their college attainment, and their experiences in the workforce also improve. I think private philanthropy is going to have to be the solution here. And certainly in many parts of the country, that is what's happened. I've been very impressed with private philanthropy during this pandemic. Many large philanthropists, from the ECMC Foundation to the Lumina Foundation, Imaginable Futures, Gates Foundation, many others are working together collaboratively to distribute emergency aid funds. And I think that the question now is, now that it's become clear that these students are going to be cut out of the CARES Act in this way, whether they're going to reorient their dollars and direct them to fill in these gaps. And you could certainly work with your state philanthropist to talk about that.
Yeah, and like Sarah was saying, we at SingleStop, we have really leaned on private philanthropy during this time to help undocumented students. And so that's where our resource tool comes in, where we can search for organizations in their own communities that don't have those type of guidelines, that, food pantries will feed people, childcare assistance, those things that are not necessarily directly from the government and aren't impacted in the same way. And then the state by state also plays a role, right? So my office is in New York City, where we have programs here for undocumented families where we can connect them to healthcare, which during a public health crisis is really important. And so our research and policy team becomes very important at a time like this, because we do a lot of state by state research so that we can make sure we're giving people the most up-to-date information and about what's available in their own states.
Great, thank you. We just have one last question, which is prefaced by, it's a very open-ended question on SNAP waivers in the time of COVID. Are there any tips you have to share with states?
Do you all want to go first, SingleStop?
Actually, so it's interesting because we've been putting together some documentation on this. And what, I don't know, it doesn't say what state they're talking about. I can definitely share after this. I'll share our state by state tip sheets that we put together on SNAP waivers. But like Sarah has said already, you know, students in particular are often negatively impacted when the rule changes don't take into account their life circumstances. And so we try to work with providers to help talk through students and anyone who comes in about what they're actually eligible for.
Yeah, we've been taking a look at this and certainly have recommendations for specific states depending on what your circumstances look like. I think it is really hard, frankly, to give good advice here in a very generic way, but I invite anyone to contact us if you would like to talk that through with our policy team.
Thank you so much. Before I hand it back to Jesse, I'd like to thank our panelists, but I'd also like to shout out Sandy Caldwell from Wyoming. We see that there's a lot of work that you're doing, and that we are happy to work with you to highlight that work in the future. Jesse?
Great, thank you. So quickly, just wanted to highlight some general resources as we close out this webinar. So as you'll see, I included the links to both the Hope Center and SingleStop. I also wanted to highlight Schoolhouse Connection, which is an organization that focuses on the intersection of education and homelessness, as well as Student Arc, which is an online collection of tools, reports, news, and insights about how institutions can support students with emergency aid. And also COVID-19 related resources. There was such a wealth of information that was shared by our presenters, which, thank you so much for. Also just wanted to include the press release from the Department of Education about emergency grants, as well as NGA's coronavirus resource page, and the specific web pages for both the Hope Center and SingleStop. And so lastly, here are some next steps for NGA and the cohort, including forthcoming products related to this topic at hand and other webinars in the coming months. Our next webinar will be focused on innovation grants and is scheduled for May 20th at 3 p.m. Eastern Time. Also, as a reminder, Michael Bartlett, Senior Policy Analyst on the NGA team, will now be leading the cohort activities, so please expect all emails and invites to be coming from him moving forward. And thank you all so much for your time. Special thanks to all our presenters, Sarah, Joy, and Rebecca, for sharing your expertise as well as your resources. And please remember that the NGA team is here as you continue this work, and that we'll be in touch soon. Thank you so much, everyone.